Hello, everyone. It's Dr. Durst with RevMD Sex Bites Podcast. So if you have this, then you have been Googling it and you know what it is. Peyronie's disease. So today we're going to talk about that. What is it? And guess what, guys? There's a treatment for it. So stay tuned. So welcome, everyone, and thank you for joining us today. And so I have a guest with me today, and this is my right-hand woman, and I'm going to let her introduce herself.
Hey guys, my name is Faraday Golombieski. I am a nurse practitioner. I've been a nurse for over 10 years, and thanks for having me today so that we can discuss Peyronie's disease.
This is an important topic because there are traditional treatments, and then there are some non-traditional treatments that you may or may not know about. And so we want to discuss those options with you. So what is Peyronie's disease? Peyronie's, it's pronounced a couple different ways, but again, what is that?
So Peyronie's is essentially scar tissue. So we do know that it is caused by trauma to the penis. And you think trauma to the penis, okay, so I would know that that's happened, but not necessarily. A lot of guys do not know it wasn't like a big event. They didn't have like some big accident or anything like that. It's just small injuries that have repeatedly happened that have caused these scar tissue formations. Because when we cause injury there, it's kind of disorganized when that tissue heals, and you can have little lumps or bands of fibrous tissue that form. It can start out pretty mild, and then it can be pretty severe. Typically, the time frame that happens over can be a couple weeks to up to a year in time frame, and progress with time. But
very variable per patient.
Absolutely, but it's scar tissue.
Yeah. And about 80% of people actually, in some of the studies, don't know. 80% of men don't know a specific event that happened that caused it.
Which is crazy because you would think, you hear the word trauma and you think, oh, it's when this happened. Because, it's kind of a sensitive area for you guys. You tend to know what's going on down there.
And when there's trauma, for sure. And then even like pre-surgical, you'll have Foley placements. That's potentially, minor trauma. Again, should not cause something like that, but can. And so, but 80% of men won't know. That's, don't be afraid you're going to, get it at some point just because it happens and it's not a trauma. But again, if it happens, it can be pretty mild early on, but that can progress, and it depends on what period of time. So you could have a little bit of pain.
Yes.
Without an erection first. You could have curvature first. You can have pain with
erections.
With erections.
That's a little bit more severe, but typically it starts out that you notice, a little change in shape, right? We call it penile deformity. It can curve up, it can curve down, it can curve left, it can curve right, but it does not curve the same way it did before, right?
Yes, and it depends significantly on where that scar tissue is. So whatever direction it's curving is where the scar tissue is. And so again, that scar tissue is sometimes easier to feel with an erection than it is without. But most of the time, you know where it is, you know which way it's curving. And so you can actually point, a provider or a clinical person or your doctor to that area so that they can feel the scar tissue there.
Sometimes you can even have more visible changes. You can have fibrous bands. So you can have an hour-shaped glass kind of change. You can have narrowing. You can have indentions. So sometimes it can be pretty severe. But other times it could just be a tiny little area that isn't super painful, but it's just a change in what's normal for you.
So the important thing is that, again, it is a progressive condition. So once it happens, it's progressive. So it's good not to ignore it early on. So if you're noticing a small curvature, any issues, that would be the time now, because there's more information out there so that you can know if there's a little bit of pain or a little bit of curvature, that's considered scar tissue Peyronie's disease, and there's some things you can do about it. And the earlier on, because as you mentioned, Faraday, like as they get indentations, that becomes a little more difficult to treat, or calcifications, that becomes a little more difficult to treat too. And even some of the traditional FDA approved treatments for it, such as Xiaflex, which is something injected into the scar tissue, isn't
break down collagen.
Yeah, it breaks down collagenase is what's in there, and it breaks down collagen, but that isn't even effective late in the game. And so once you have an indentation or calcification, then that's not indicated because the improvement is very minimal, if at all. And again, surgery is another option, which isn't always a great option because it doesn't always work.
Yeah. And it's not an option in the beginning because you're having changes. So typically
Correct.
You've got, like Dr. Durr said, it's progressive. So you have this acute phase where you're having these penile changes, and that can occur over a couple weeks or up to a year. And then you have a chronic phase, which is, okay, all the changes that are going to happen have happened, and now you're stabilized. So meaning it's not going to get any worse, but it's not getting any better. So typically for a doctor to say, okay, surgery is a good option, which that is an incision or excision, right? So they're either making small cuts, maybe removing tissue, maybe placing a device inside the penis to help keep it erect after, whatever it may be to help straighten it out. That is during that chronic phase. So that's never recommended in the beginning because you're still making changes. So if they do surgery too soon, you've got to repeat it.
It comes down to, again, a difference in regenerative medicine versus traditional. Hate to drive that point home again, but instead of waiting for something to be so bad it's treatable, so that you have a condition that you have to treat, instead you can get early on. It's not going to do damage when you're doing something, and that's what we're going to talk about today, those things we can do early on that aren't going to progress and are actually going to reverse and help heal that area, because otherwise, surgeries or even Xiaflex. So Xiaflex, it's too late once it's chronic and calcified or indented.
You want to do that during that acute phase.
And surgery, you have to wait until it's late too. And so again, we're treating. So what are the different things we can do in the acute and early phase? Well, that's what we're going to talk about today.
So one we've talked about before on other podcasts, not necessarily specific to Peyronie's, but is shockwave therapy. So in our office, we use Gainswave. There are other devices out there, but that is the one that we use. And that shockwave therapy is used to help break down that fibrous tissue. So it can help decrease that tissue, help with pain, help with erectile dysfunction, because Gainswave or that acoustic shock wave therapy also helps with remodeling of the vasculature and healing of the vasculature. So there's also improvement in that blood flow that can occur with erectile dysfunction. That also happens with Peyronie's.
Yeah, so you're basically doing two things. You're hitting that scar tissue for remodeling, and we're talking about collagen 1. Remodeling is the good collagen we want in there. It's the strong collagen, and right now in a scar tissue, the collagen is going all kinds of different ways and not aligned together to create strength, and support like it's supposed to. So instead, you're going to remodel, regenerate, and get collagen 1 formation, which is going to help with strengthening of that area. And then the acoustic shockwave device also, like Faraday said, improves blood flow. So it's doing both of those. And again, Gainswave is a provider network and protocols. So everyone in there is trained on specific protocols. And there's a couple different machines are used during those. There's lots of knockoff, treatments, machines, all of that aren't providers in a Gainswave network of providers that are trained a specific way to provide, the acoustic shockwave therapy effectively with protocols that are known to work. So that's just telling you again, if it doesn't say Gainswave, then it's not a provider in that network using those protocols. And so is that reliable? Who knows? It may be, but it's not guaranteed. Where if you go to a specific, very standardized treatment protocol for Peyronie's, and we're using acoustic shockwave at a certain level, and we're hitting the scar tissue and the blood vessels, then you're getting those added benefits together by Gainswave. And again, it's a simple procedure.
Non-painful.
That doesn't hurt. 20 minutes, maybe 30, but 20 usually is the time frame. No pain and no medications. No
injections. No cuts.
No cuts.
Surgeries.
Yeah.
We're not talking about doing any nerve damage. We're actually talking about nerve repair.
Yes.
Which is fantastic. So we know that shockwave therapy helps not only with breaking down that scar tissue, but with that nerve repair, with helping promote stem cells, with helping promote healing. So these are all added benefits.
All good things.
That are all good things without the negative side effects. So when we're talking about medications or surgeries, we have to talk about the side effects of those medications, negative side effects of what those surgeries could possibly bring. Or they also talk about, penile traction and modeling. And so really it is a device that you put on your penis to bend it the other way, which can be painful and may or may not work. So this is something that is very non-invasive that we know has multiple benefits. So not even with Peyronie's, but also with remodeling, repair, regeneration.
For erectile changes.
Erectile dysfunction changes, absolutely. It helps break up that fibrous tissue, which is the goal anyway.
And so again, as a man ages, he's going to have changes in erectile function. And so GAINSWave is used to increase blood flow and regenerate in better nerves and sensitivity, better orgasms, stronger erections, all that. So we're not tailoring the GAINSWave treatment just to the scar. We're doing a GAINSWave treatment like we would for erectile changes. So no matter what, you're getting that added benefit of regeneration and blood flow and better erections. And now we're also concentrating on the scar tissue because you have that there. And again, the sooner you notice any kind of curvature, mild curvature, discomfort, you're noticing any changes, that would be the time to start GAINSWave. So there isn't a reason to wait. The reason they wait for XIAFLEX until later is because they may inject it and then it's going to continue to get worse. It's breaking down collagen. And so again, one of the side effects, one of the warnings on XIAFLEX is that you can get penile rupture or the corporal rupture. And that's because you're breaking down collagen. So you're actually injecting something to break down collagen in a scar, but we need collagen for support. And so without that support, you can actually get rupture where it was injected, where what we're doing with acoustic shock wave is regenerating. Again, no medicines, no injections, no pain. And
no
we're
cutting.
Generating good collagen. We're not taking any collagen out. We're just remodeling that collagen down to be lined up together and working together for strength and support. And so again, regeneration. I mean, what's better than, and again, I would argue I would do anything short of cutting, if I could.
Exactly. Right. You want to avoid surgery at all costs unless absolutely necessary. Pretty much in all aspects of medicine, your penis is included in that, right?
Yeah.
If you can avoid cutting on it. There are some pretty big negative long-term side effects of surgery if you that you would want to avoid if you can.
You can, yeah. And so again, this is one of those places where you can. There's things you would definitely want to try beforehand and you can try early on. So worst case scenario, and it's, not really going to happen because again, you're doing it early on and you're going to improve symptoms and curvature and function. But, that option's always there long-term because that was always a long-term option anyhow, surgery. So then including the P-shot, if you want to talk about the P-shot a little bit as well.
The P-shot is a platelet-rich plasma. So we take your blood, we spin it down, we take that those platelets and we re-inject back into the body. And we really do focus on those fibrous areas again, because we're trying to regenerate and heal and bring growth factors and stem cells to an area for long-term repair. So this is not a snip, snip, cut, hope it all works out for the best. We're talking about actual changes in the body, regeneration. So like GAINSWave, the P-shot, they're sustainable. So meaning that we do these procedures and we see regeneration and we see the positive benefits ongoing. So with the P-shot, your max benefit 3-4 months out from your shot because regeneration takes time, guys. But then those benefits are prolonged 1-2 years. So it's not like we're turning around and doing it again right away. So we are seeing long-term benefits.
Yeah. And so we're always going to recommend P-shots with GAINSWave therapy because again, you're hitting the scar tissue. And again, all of these are also used for erectile changes. So to improve erection quality, strength, hardness, firmness of an erection. Who doesn't want that? So in addition to treating the scar, we're also treating the entire penis blood flow, getting regeneration and better erections. And so we're combining them always. It's 20 or 30 minutes, 20 usually for a Gainswave, painless, and we do them in a series of 6. Do we need 6? Do we need 12? Do we need 18? That's really dependent upon a function. And it's a score, an objective number we do with you. But then we combine P shots into we do 1, 2, or 3. So we can get you there. It depends on where our starting point. And then we can get you there. And then once we do, again, like Faraday said, we're talking about, 1 to 2 years, we're repeating or we're readdressing to make sure, that there is ongoing sustained results with it. So,
absolutely.
And that's dependent on your feedback. When you start to notice changes, some men love, the Gainswave treatments and want to have one on a monthly basis or a quarterly basis, or they want to get treatment, once a year as a maintenance, and that's okay. That's dependent on you, but we want to get your scar tissue under control. Yep. So that you don't have as much curvature. And again, this isn't just about the man and curvature and the fact that it's painful. Ultimately, it's progressive to erectile dysfunction. So we're already addressing that early on, even if it's something mild you were experiencing. But this is significant for partners too, because again, if it's painful sex for you, that's something that's hard to hide, but it also gets painful for the woman and your partner as it starts to progress more. And so,
or you're unable to perform anymore because your erections have gotten to a point where it's so painful that you don't want to have an erection. And we've had guys that have come into the office and said, it hurts to get an erection, so I'm trying to not have them, and that is the opposite of the goal, right? Mm-hmm. So it's interesting because you hear a lot about it. If you're listening to this podcast, maybe you've heard about Gainswave, maybe you've heard about P shots, and then you might get on Google and start looking, and it's been on The Doctors. Mm-hmm. That was 4 or 5 years ago, maybe they did a whole segment on Peyronie's and Gainswave treatments and how it helped a gentleman. They had him and his partner on. Mm-hmm. Yeah. We're hearing it. Just recently had listened to the Grand Rounds of Urology, and it was one of the doctors that was involved in the AUA, so the American Urology Association guidelines, talking about erectile dysfunction. And they're talking about acoustic shock wave to help with erectile dysfunction, because they know that at 40% of men can be affected. And that means that about 70% of men can be affected by erectile dysfunction. So even our larger associations and our other medical groups are starting to say, oh, this actually works. We see it. We have patients saying that they're seeing improvements. There is more data coming out, more studies. There's just not a ton, but it's gaining traction. So the more you hear about it, the better, because that forces more studies on it and more research.
Yes, no, absolutely. And again, studies take decades sometimes to get there. And so we're getting there now because it's been used for long enough that we should get some good data. And again, you'll hear the doctor show with that couple was great. We have a video on our website as well with a couple that were comfortable enough to talk about it, because that's the one thing sometimes people don't want to have a conversation about that. So it's nice when you have couples that are very open to allowing other people to learn about treatments and how they help, because you'd rather hear it from them than from us directly. But in addition to what we've talked about in the P shots, again, we have other videos on them, so please watch. And it talks about the P shot, but that is, again, using platelet-rich plasma, which is your own blood. Platelets have growth factors, and then injecting the growth factors into the penis with regeneration of tissue in the penis. And it's not painful. It might sound that way, but again, it's not painful. We've been doing this for many, many years. And again, we know how to make that comfortable. And you can use a block, you can use topical. There's all kinds of different things. And we actually inject it into the scar tissue as well. So likewise, Gainswave and P-Shot are both used for erectile changes and dysfunction to get improvement in harder erections. And we can use them for that with Peyronie's disease. And then we also treat the scar. So it's very beneficial for you all the way around, and the earlier the better. The other thing that we haven't talked about yet is like, so traction devices, one thing, but also vacuum erection devices is another thing that can be used. And
so the more blood flow you can get into the penis, the better. Healthy blood flow, right? So guys, I know everyone, it's like their worst thing to hear from me, but pump.
Yeah. Absolutely. And the pump is shown to be very beneficial with Peyronie's disease. It's like a traction device. So the traction device, like that to me, I think would be maybe something you'd be more resistant to because it's traction and it's just holding it in place for 10 minutes or so, a prolonged period of time, where you're doing the same thing with pumping, but you're getting that blood flow in. It's actually a vacuum so that you get blood flow in and erections and that traction at the same time to help with the scar tissue. And that's in addition to the Gainswave in P shots. And usually we're doing, about 6 Gainswave to every 1 P shot. And we want you pumping twice a day, 10 minutes twice a day. And that's going to help the better results. Like, again, if you want results, and you strictly stick to protocols, it gets you results. And that's what you want. So ultimately, we will support you in however we need to.
I think that's probably what people dread the most is for me to ask them, are you pumping?
Yeah. How's the pumping going?
Yeah. Oh, you haven't been pumping? You should be pumping.
Yeah.
Remember that whole healthy blood flow thing?
Yeah.
Pump, please.
Yeah. Again, we're encouraging in the office, if we had to you can bring your pump with you and, while you're waiting, do the pumping too. And then we do the Gainswave, we just need to make that happen for sure. So ultimately, again, this is a progressive disease. And so if it's curvature, it's mild, if it's pain, those are going to progress both in curvature and pain, but you're also going to eventually get erectile dysfunction because of it.
And shortening. That's something we haven't talked about, is that sometimes we'll see shortening. So you see loss of length as well.
And that's where surgery is not beneficial. It will cut. And anytime you're cutting, again, you're going to shorten length no matter what. So these are regenerative procedures, with traction devices that might potentially increase girth and length, potentially, really girth, if anything. And so who doesn't want a girthier penis too? Harder erections, girthier penis. And these are treatments you're going to be doing as part of a protocol. So a comprehensive treatment plan. So again, it all is progressive. The earlier, the better, but there is no point that's too late. And so we can still treat late in the game, which is something, again, surgery's only late. Yeah. With minimal options and medications injected in, already are just breaking down collagen and not supporting regeneration. So to me, again, when we're talking about FDA approval of stuff or waiting for studies, there's warnings with XIAFLEX, and it's a medication. Pfizer was the drug company with that. And I do think there's been some times when Pfizer was moving away from XIAFLEX being used because it wasn't being used that much. But those are things that are actually going to have some side effects and some bad effects and this is something that's just regenerating. And so it's not harmful. And
you're not going to have a negative side effect from Gainswave or acoustic shockwave therapy.
Correct.
And then even with your P shot, you may have some bruising at the site, maybe. Not common, but could happen. Yeah. Maybe a little bit of irritation at the site of injection. But again, not common, but maybe. But it's not a medication. It's not something formulated in a lab. This is your own blood. This is your own regenerative properties that we're re-injecting in for your body to heal itself the way it should, the way it was meant to.
That's right. Giving it back what it needs to heal.
Exactly. So it's not taking a pharmaceutical that's going to have a list of negative side effects we have to watch out for.
Yeah, and early on, we could say it wasn't going to be harmful. Any of the treatments were that we have part of our protocol and comprehensive plan, that they weren't going to be harmful, but were they helpful? But now we have data that also shows it's helpful. And so we'll get more and more support with that, but that is the case. Again, I would encourage you to, do some search for videos. There's also forums with Peyronie's disease, and people talking about what they're doing for that. And a lot of that is GAINSWave and PSHOT.
I think it's awesome that we're seeing these larger associations like the urology groups and stuff like that, doing some of that and looking into it and going, okay, look, we know it works. These not long shockwaves, short.
Yes.
Short. So they're short waves, high pulses, and they're very effective in helping break down that tissue. So I think that the more you hear it from even traditional, and not just functional medicine providers, it helps kind of reiterate, okay, it's effective.
No, I love hearing it.
Yeah.
I love seeing it. I look forward to seeing more and more of it.
I love seeing it on
time.
the TV, seeing the doctors doing it.
Yes.
And it just, it's not on TV and not being talked about with these large groups if it wasn't effective.
Yes.
So I think when you see something gain traction like that, it's because you have enough people saying it's helped.
It's helped, yeah. And so I love it. And again, a lot of these providers and specialists, even urologists, are so busy doing their, surgeries and things that are needed. A lot of them are, now incorporating some of the, regenerative acoustic, but they'll refer on,
and they refer
when
out,
they're not doing it, which is awesome. So again, if you have any questions or you want to share your experience, please, in this regard, especially with Peyronie's, something specific, please share your experiences with
Ask
what
us
you've
your
done.
questions.
Ask any questions. And again, if there's anything that we haven't discussed yet on our YouTube channel that you would like to hear about, please give us ideas. And again, hit the subscribe button, share with friends, share with loved ones if you know somebody, that has this condition. And again, we're here to revitalize your look, your health, and your sex life.